Hey everyone, this is Tony Reeves, and welcome to another installation of Easy, but Not So Easy.
Hey everyone, if you enjoy the content, please hit the subscribe button down below.
And today we're going to talk about why access to healthcare is not as accessible as we seem. The easy part about our healthcare system is that we have a great healthcare system. We have great docs, great nurses, great technology, great clinics. We have a lot of awesome places where you can get some of the highest level quality care anywhere in the world. And we are very proud of it. Not only are we proud of it, but we train people when they come here so they can take those same skill sets and go abroad and utilize them. The not so easy part is understanding that access to care is not the same as actually having it. Meaning there's a distinction between those people who have to pay out of their own pocket or self-pay, those people who have insurance. Distinction between being a part of what's called a PPO program or an HMO, where PPO you can actually go to whatever doctor you believe is necessary to help your condition. An HMO, you actually have to go through your primary first in order to have the doctor refer you to the type of treatment that you need. That if you don't have insurance, you have to juggle between community health care, health department, charity. The one thing that's the linchpin for all of this is our difficulty in recognizing, preparing to make that turn. When you're in that position where you have the best level of care because your insurance affords you that access, you don't know what the world is like until it's taken away. If you are working or you're paying for your own insurance, you don't feel like you want to have to pay for someone else until you're in a situation where you need access to that care. And then when you're in that situation where you're now realizing that, oh my gosh, I need to have access to some of these other services, and you're trying to figure out why I don't have as much access as the other persons do, you're realizing quickly that because you weren't preparing for that reality, we have great health services in our country. But the not so easy part is preparing for the reality that at any given moment, you could have great insurance and the ability to access the best doctors in the world one day, and then one moment something can happen and all of that can disappear. And you may need to access some of these other supplemental sources that provide great care, but unfortunately are stretched very thin in terms of who they can support. If you know all this ahead of time, then you can be a little bit more aggressive about pushing your elected officials to making sure they put in place an infrastructure that ensures that regardless whether you're working for somebody or you're out on your own, we all have access to the same level of care.